We turn now to Niagara's acting medical officer of health, Dr. Mustafa Hirji, for an update today. Dr. Hirji, almost 30% of Niagara has now received its first dose of a COVID vaccine, but we're still a long way from being able to let our guard down.
Yeah, that's absolutely true. So, there's a couple of factors that are working in our favor and some not working in our favor. When there's more cases around, that means there's more risk of spread because there's more people who can be spreading. And of course, we're seeing very high cases. We're seeing more variants now. Variants are now a majority of the cases we're seeing, and those variants spread more easily. So those aren't working in our favor. The vaccination is helping to slow it down, but it's not enough on its own. And that's unfortunately why the province has been announcing some more closures and some more measures to really reduce our social interaction, because that close social interaction is what gives the opportunity for virus to spread.
When you talk about the variants, I know we've had quite a few of the UK variant cases. Have we seen any of the Brazilian and South African ones in Niagara yet?
We haven't had it confirmed in terms of genetic sequencing to identify that those are there. That being said, there is a handful of the screening results we've gotten back, upwards of about 30, that based on the screening are possibly the South African or the Brazilian variant. We're still waiting to see a final confirmation of that. I am suspicious that we're probably seeing some of the Brazilian variant around. That has been really rising across the province, across Canada even, and I'm very concerned that there's a bit of that around here too.
There is some concern now that some people who have been vaccinated have actually tested positive for COVID-19, and that's kind of alarming, I guess, to a lot of people.
Yeah, I can totally understand why it's alarming, and it is absolutely true. I wouldn't say it's a very large number, but there's definitely several cases now where someone has previously had COVID-19 and they've been reinfected. And there's a few things I think that lead to this. First off is those variants. They're a mutation of the virus, and so sometimes they are able to still infect us even though we've previously had the infection or even though we've had the vaccination. And I think that's really working and not in our favor. The other thing we've seen is that unfortunately, no vaccine is going to be perfect. So even some people who've been vaccinated are still getting COVID-19. And that's why it's really important that even if you've previously had COVID, even if you've previously been vaccinated, you still need to make sure you're taking all of the precautions, because it's only with all of us doing it together we can really slow COVID-19 down as much as possible.
Are these people who have been vaccinated, are they experiencing lighter symptoms or are they being hospitalized?
There's not enough of the number to really get a good statistical sense. Our belief is that we're not really seeing people hospitalized amongst that group, but that might be just a small sample size still. There are a few persons, though, who have had more severe illness, so I can't absolutely rule it out.
At his State of the Region address, Chair Jim Bradley mentioned that he really needed business to pull together and support the vaccination effort. How can businesses here in Niagara do that?
Yeah, I think it's an all of Niagara effort really to get vaccination out. And we have lots and lots of many partners who are working with us, local municipalities, community centers, volunteers who sign up to help us. There's really three ways that I see our business community really helping us. First off is helping to get that message out and set that social norm that we all want to get vaccinated, because that's what's going to help us start to return a bit more close to normal. I think a second role is that, of course, we have lots of people who work in a business. They might not have the ability to find time to go to a vaccination clinic. If there's ways workplaces can help people to get vaccinated by giving them some paid time to go to the clinic to get vaccinated, or busing people over a day to get vaccinated, that I think could be another way it could help. And then finally, businesses often have really close connections with the community, particularly if it's a minority-owned business or a female-run business, or it caters to a certain population. That's a great entree we might be able to leverage to hopefully encourage those groups, if they're not getting vaccinated, to getting vaccinated. So hopefully they can help us engage with some of those populations.
We're up to about 2,000 active cases now. We're pushing against that 200 daily case count as well. These numbers are a far cry from back before Christmas, when a number of 60 was one that would leave us kind of concerned.
Yeah, or even if we go back to last summer, where when we were above 2 cases, I think we were quite concerned. So we can absolutely get a sense that there's a lot of risk now with COVID-19 spreading around. I think that's really why it's so important that we take the current provincial stay-at-home order seriously. We're seeing news stories about how our hospitals are being increasingly overwhelmed. Niagara Health put out a statement yesterday that they're past their normal 100% capacity for their hospital and ICU, we really need to all pull together and cut off our social contacts so we can bring these cases down, get things back under control, and then hopefully later this summer with that plus vaccinations, things will be at a stage where we can actually start to re-engage in some of our normal lives.